Okay. One of the amazing things about the UTEST program is in the last couple of years, we've actually expanded into the research hospitals as a result of, the Toronto Innovation Acceleration Partners relationship with different groups. The next group actually comes out of CAMH, and I think it goes without saying, we are in a mental health crisis right now. With a treasure trove of hospital-based mental health data from CAMH, I'd like to introduce the group to Kelello Health that has built the next generation of mental health decision support technology. So over to David.
Thank you very much. Just checking you can hear me. Sounds like a yes. Thanks so much. So thank you for the introduction. I'm very pleased to be here representing Kelello Health. It's a startup from CAMH, the Center for Addiction and Mental Health, and we're focused on personalized medicine in mental health. First, we want to recognize the substantial cost of mental illness worldwide. Over 50% of people experience mental illness in their lifetime, which represents over 792 million people suffering from mental health disorders today. This also represents a leading cause of disability, with approximately 37% of our healthy years lost, and is estimated to cost the global economy $4.2 trillion annually in lost productivity and treatment costs. While the distribution of mental illness around the world varies, by prevalence, the most common disorders are anxiety, depression, alcohol and drug use disorders, bipolar, and schizophrenia. And so Kelello Health was born to really tackle this truly global challenge. Fortunately, there is an effective means to support the treatment of mental illness in the form of measurement-based care. Fundamentally, this relies on the repeated administration of clinically validated measures to help inform the treatment trajectory, i.e., the physician receives feedback about the current state of the patient and makes a decision about whether to change the drug, change the dosage, or look for a different intervention altogether. And through numerous clinical trials, this has been demonstrated to have greater and faster response rate for patients, as well as lower remission rate. Unfortunately, measurement-based care is underutilized, with less than 20% of practitioners engaging in it, and as little as 5% using it according to a structured pathway, which is really key to its efficacy. We've had numerous interviews with physicians and clinicians across the country to understand what these barriers were that were preventing adoption of measurement-based care, and there were 4 key reasons. The first was that clinicians lacked evidence-based care pathways. What assessments to use with what frequency for what disorder, that wasn't clear for them. Second, they lacked the fundamental systems and technologies, i.e. the resources, to implement this within their environment. And the EMRs they did have weren't designed for mental health. Third, perhaps unsurprisingly, clinicians are very busy, as are their clinics, and so they needed something that was truly seamless to deliver measurement-based care in their environment and not add to the burden. And lastly, there needs to be some feedback mechanism. So it's one thing to have a bunch of assessments in the environment, but you have to be able to get them back and see the trajectory of the patient to really make that informed decision. And through our work, we're very proud to introduce the Kelello Health platform. We created a comprehensive patient-clinician co-designed measurement-based care platform for treating mental illness that further leverages artificial intelligence to improve care and the patient experience. Using our platform, we can deploy streamlined measurement-based care pathways for a variety of disorders with intuitive data collection for the patient. These data are coordinated through a proprietary clinical knowledge graph and returned back to physicians with dynamic interactive decision support dashboards that are further augmented with artificial intelligence to predict the course of treatment and have other augmented indicators to support decision-making. Ultimately, the Kelello Health platform is designed to engage the patient clinicians in their shared treatment journey. So far, we scaled to 22 different pathways across different disorders in 7 clinics. Through the platform use, we've seen increased clinician adoption rate, increased patient enrollment, increased workflow efficiency, and data quality compared to traditional paper-based methods. Working with our leading physicians, they've had great feedback for us about the performance of the platform, but also that it's really designed for them and for the diverse clients that they support. Now, to introduce the team, we have Dr. Sean Hill, our current CEO and Chief Scientific Officer. He has world-leading experience in software and data system design, such as co-director of the Blue Brain Project, and currently leads national and provincial programs in the mental health space. Myself, David Rotenberg, I'm Chief Operating Officer and Chief Technology Officer. I have a background in medical physics and building and supporting data systems and platforms, and I lead our informatics team, as well as just having graduated from the Rotman with an MBA in health and life sciences. We're joined by Adil Ansari, our knowledge engineering lead, who supports the complex medical data modeling that is staged directly for our AI algorithms and machine learning operations. And further, we have Dr. Stefan Kloiber, our Chief Medical Officer, who's a world-leading physician in treating mood and anxiety disorders and is a lead for our premier depression pathway. We also have a diverse advisory committee with people from the wider medical space environment, as well as a great team to support the technologies we've developed to support the Kelello Health platform. Looking at our competitive advantages, we're directly integrated with the Center for Addiction and Mental Health, which is a world leader in treating mental illness. Indeed, it's the largest mental health hospital in Canada and one of the largest in the world. Through this direct partnership, we're able to incubate high-quality, validated, measurement-based care pathways across a diversity of disorders and work with our clinician scientist network and patient groups to ensure its efficacy. Further, this gives us access to a unique data set for AI development and deployment, and we have proprietary clinical knowledge graph technologies and a novel care plan builder to construct these data. As of March 2021, we already had 3.7 million data points and 7,500 patients. We've grown since then already. Looking across the broader space, our closest competitor actually lacks some key features of what we're really trying to offer. What we're looking to do is provide these clinically validated pathways directly to clinics within Canada, but also within the world. This allows us to scale good quality best practice treatment to lots of providers and help tackle that global burden. We also have a good focus on AI indicators to look at the patient trajectory and make predictions that help with the care. Furthermore, there's OPT, which focuses very purely on cognitive behavioral therapy, a rather narrow window, whereas we're looking to support a number of different disorders across the spectrum. Otherwise, there aren't many players who are really looking at mental health in this detail at the current times. We feel very confident about our competitive advantages and our ability to have a unique offering. Looking at total available market, there are over 350 million people currently suffering from depression worldwide. While I've noted we have over 22 pathways, this is one initial target market due to its prevalence across the globe. There's been $3.4 billion spent on mental health software in 2020, estimated to scale to over $7.6 billion by 2027. The number of customer segments we're looking to work with, some we already are, and this is organized roughly in terms of scale. So first, we want to work with clinics, public, private, and community who can use our platform to deliver direct care to their patients. Second, as we've done with CAMH, we can integrate more closely with health systems, hospitals, service networks, and primary care. We see significant potential in industries such as pharma and clinical research, allowing us to use our structured standardized care pathways to then look at the efficacy of different pharmacological or other interventions and test those out within a broad patient environment. And lastly, we're already working with the Ontario Structured Psychotherapy Program, and we see many opportunities with government organizations regionally, nationally, and internationally. Looking at our revenue model, there are 4 key streams we're looking to tackle. The first is deploying this as a standalone measurement-based care pathway with cloud-based delivery. In effect, a clinic selects from a pathway or pathways for the patients they want to support. We provide them with the technologies to do that, as well as our customer support for them. Secondly, we can integrate directly with EMRs as we've done with CAMH, both from a data collection and a visualization perspective with on-premise implementations. Third, we can design new pathways dependent on what different customers would like to have, including support with the creation, validation, assessment development, and custom visualizations as necessary. And lastly, we can augment additional personalized AI models to support those different clients, validate and deploy, as well as integrate research data as we've further done at CAMH. Looking at our trajectory, we already had 1.5 million in our initial informatics system and 7.5 in grants from non-dilutive philanthropic funds. As of 2018, we already had a minimal viable product that was launched with tablets directly in the clinic. The pandemic changed quite a bit of that, and we rapidly changed to adjust and further expanded to 7 pathways and continued to refine our product offering. We then moved to AI indicators integrated into our visualizations and scaled to 15 pathways across 7 clinics. And as of today, we have over 4.8 million data points across 22 pathways and already have partner sites we're working with today. At this point, we're looking to accelerate and inflect and are seeking $1.65 million in capital investment to continue to grow. Foremost, we want to invest heavily into the UI and UX experience of our platform and truly productize it so we can deploy it in different clinics and primary care centers within Canada and beyond. Through our interviews, UI UX has been crucial to ensure an absolutely seamless experience for our clinicians and patients, and that's where we want to focus first and foremost. Second, of course, is marketing and customer base to add pathways, data, and new AI indicators. And naturally, the more data we have, the more accurate and powerful our AI indicators become. And so then I'm going to pause and thank you so much for your attention. Real pleasure and open to any questions you might have.
Awesome. Thank you. One question. Physician uptake of MBC is low. How does your product change the clinical routine?
That's a great question. So fundamentally, we're trying to introduce a new mode of practice. And when we spoke with the different physicians and clinicians, they definitely get it. They want to do this. But the difficulty is having a tool that is integrated and able to support that. And so it will change the routine for the better in the sense that we've seen an increase in the number of patients that physicians can see. It streamlines the process dramatically since the assessments are already collected and complete and absolutely available for them to review within the moment. So they spend less time looking through the chart and digging through it and more time with their patients.
Got it. Next question. As you stated, there are many mental health apps currently on the market. What would you say is the greatest differentiator of Kelello Health?
So that's a great question. I think our collaboration with CAMH is really substantial. They are the largest mental health hospital in Canada, and their support has been overwhelming. The fact that we can take the expertise from CAMH, build out care pathways that really help improve patient outcomes, and then share those with the world is truly unique. I think it's a powerful way for us to help improve mental health, make it a very valuable product for lots of different clinics and care institutions globally.
Next question. How do you think about selling into the US market, particularly with so much competition in this space?
It's a great question. We do think there's a lot of opportunity in the US market. We're already working with the Henry Ford Center for Health. They've been very interested in this through a connection through the Ontario Brain Institute. We think that there is a lot to prove. We do want to start with Canada. We think that's our home base. That's where the CAMH brand is currently the strongest. But we definitely want to move into the US market despite the competition because of the unique offering that we have.
Okay. Is there any legal or medical liability in providing insight into mental health? How do you get around this potential issue?
Yeah, that's a great question. So there's certainly errors in commercial EMRs. Those do happen all the time. First and foremost, we're absolutely committed and within the privacy realm that we work in to privacy, integrity, and accuracy of all of our data. So when they're collected and presented back. However, despite that, the mechanism is really advisory. Clinicians and physicians still need to make their own decisions. These are to help augment what they're doing and then inform their practice, not to make a decision for them.
Okay. At what point would you intend to start charging for the service rather than getting it to as many clinics as possible to increase data collection?
A good question. As soon as possible. We'd like to have that revenue stream as soon as possible to support sustainability. We think that's fundamental.
Okay. Building on the last question, how do you ensure sufficient uptake and reimbursement of this product in new clinics?
That's a great question. So first, I think to the other point is demonstrating that it works for them. It provides value. We're looking at the reimbursement models currently with support from Rotman MBAs as well as our internal technology transfer team. So some of those questions are still pending, and we're building out models to do that.
Okay. Two-part question. How are you going to deal with the massive heterogeneity of mental health disorders that goes beyond the current state of care? And then part two is, do you have a plan to get beyond the current, blocky state of disorder definitions?
Yeah, absolutely. So I think that's a broader problem in mental health and the understanding of mental health. So unlike other disorders, and if we're thinking of something like oncology, they're very biologically focused. It's understood that there's a biological cause, whereas mental health often is just a cluster of symptoms. So we're also working on the biological definition that helps really pull that out of the abstract and make it more concrete. So at the end of the day, our broader program seeks to do that. In terms of the current heterogeneity, because we have so much data, that's how we're pulling out the disorders, not just based on a certain cluster of symptoms, but the broader data sets we have, which is really a lot of the strength of what we can do at this level.
One of the things I noticed about interacting with your group is, the decisions are being relayed to the clinicians. Is there an opportunity to work alongside of clinical trials groups or pharma? How do you see those interactions playing out from the perspective of your platform in their hands?
Yeah, so the way I think about it is we're kind of doing that already in a sense, because what the platform is being used for is implementing a specific pathway with a specific drug, for example, to see is it effective on this cohort of participants, other participants with pretty deep information about them that's collected as well. So it does help inform the efficacy of the treatment and changes across a pretty broad spectrum of individuals.
Okay. And, you had a funding ask there. What do you want to do from 6 months to a year?
Yeah, so we really want to move this into a full product. We're very happy with what we've built. It's been very effective in our environment, but to move it forward, we want to focus on software development, UI, UX, and then, of course, a product manager to help us refine the overall product based on our agile iterative design processes. That's crucial, as well as hosting this in the cloud. So we need to get it into an environment we can easily use it to have it scale with different types of groups.
Okay. What are the plans for international deployment outside of North America?
That's a great question. So I think that's one of the real advantages here is we can take this care model and have it in other locations. Obviously, they have different payer systems, different regulations that we need to investigate. So that will take time. We absolutely want to do that because the individual assessments can be translated. The models of care are pretty stable in many cases. They can be translated. So we want to do it. I think it is a question of understanding truly the legislative environment, the political environment in some cases. So that will take time. We want to do that.
Great. I'm just scanning the Q&A. I don't think there's anything else coming up. David, excellent work. It's great to see CAMH working with your group, and all the best.